Contemporary Australian society, healthcare organisations are increasingly pressured to deliver high quality and safe patient care, despite being challenged by a nursing shortage, as a large majority of the nursing workforce approaches retirement and coupled with the high turnover rates. Today I'm going to talk about burnout in nurses, which is directly correlated with nurse retention rates and is a significant contemporary issue due to its strong relationships between patient safety and healthy workplace environments. The transition from student nurse to newly registered nurse is highly stressful, and hence new graduate nurses are more predisposed to burnout development. Therefore, through this narrated presentation, I will draw on current literature and relevant policies in combination with audio and visual communication techniques to develop your awareness of burnout and the role of leadership. Here is an overview of what I will be discussing. What is burnout? What causes burnout? Current efforts in burnout prevention, significance of burnout in nursing, role of leadership in burnout prevention, responsibilities of new graduates, and burnout. Burnout is a core aspect of reduced work-related psychological health and represents a severe chronic strain response of the individual to ensuring stress at work. The Maslach Burnout Inventory is frequently adopted in the diagnostic tool of burnout and is characterized by a combination of three core dimensions: emotional exhaustion, depersonalization, and decreased personal sense of accomplishment. Emotional exhaustion is the core dimension of burnout and is characterized by feelings of fatigue and an incapacity to meet workplace demands. Depersonalization is defined as emotional and cognitive disengagement from one's job and results in cynicism towards the job. Lastly, reduced personal accomplishment is the feeling of being unable to make a meaningful contribution and consequently results in reduced self-efficacy at work. Burnout occurs when there is an incongruity between personal adaptive capacity and workplace demands and is attributed to a range of individual aspects such as experience and mental health and organizational aspects, notably the work environment. Current literature references the area of work-life framework to illustrate that workload control, reward community, fairness, and moral values are significant characteristics that determine the nature of the work environment. Numerous studies have demonstrated that poor levels of any of these AWL characteristics contribute to burnout development. The nursing profession is associated with continual exposure to high levels of emotional and physical occupational stresses, which are inherent to the adoption of the caregiver role within a highly time-pressured and volatile acute care setting. This, coupled with unmanageable workloads, long shifts, and rotating day-to-night schedules, which impair sleep quality, contribute to workplace-related fatigue, and culminate in emotional exhaustion. Furthermore, disempowering working conditions such as inadequate staffing, poor management practices, high levels of work-life interference, and a lack of reward and recognition frequently characterize the nursing workplace. Hence, nurses are highly susceptible to burnout because the factors associated with burnout are continually present within the nursing work environment. Firstly, the Australian Nursing and Midwifery Federation acknowledged that nurses in health and aged care are exposed to work-related stress, which can have a detrimental impact upon their psychological and physical well-being, and can culminate in burnout. Hence, the ANMF have developed a policy that outlines their active role in preventing work-related stress amongst nurses, and outlines the expectations of employers in the prevention of work-related stress, such as the provision of employee assistance programs, debriefing opportunities, and promotion of self-care strategies. Building on this concept of employee-assisted programs, New South Wales Health identifies that EAPs are effective in the promotion of staff health and well-being through their provision of early intervention strategies, which facilitate identification and resolution of professional, personal health, or work-related issues such as burnout. New South Wales Health demonstrates their commitment to burnout prevention through the establishment and maintenance of voluntary, confidential, and professional EAP counselling and referral services, which are accessible to all staff. Furthermore, the 2018 Code of Conduct for Nurses distinguishes that nurses have a responsibility to promote health and well-being for their colleagues and themselves and encourages utilization of nurse and midwife support. This is a free 24/7 national health support service for nurses and midwives that provide access to confidential advice and referral, and have published numerous online articles on the nature of burnout and strategies to prevent or address burnout. Within current literature, it is well established that the experience of burnout is strongly correlated with patient health outcomes, whereby high levels of burnout in nurses are strongly associated with increased risk of adverse patient events. According to the Australian Institute of Health and Welfare, an adverse event is defined as an incident in which harm resulted to a person receiving healthcare, such as infections, falls, and medication errors. Adverse events are utilised as an indicator of safety and quality of patient care and are associated with increased length of stay and poorer patient outcomes. In 2015-2016, approximately approximately 5.4% of hospitalizations in Australia indicated the occurrence of one or more adverse events. Increased likelihood of adverse events is attributed to the core dimensions of burnout. Emotional exhaustion is identified as the main predictor of standardized mortality ratios. Emotional exhaustion negatively impacts patient safety, whereby nurses do not possess the physical and cognitive ability to perform their role effectively. Cognitive processes such as executive function, attention, and memory are impaired in burnt-out individuals, and hence patient safety is endangered through reduced vigilance and increased response times. The development of cynicism and depersonalization in burnout individuals is also implicated in endangering patient safety. Tang et al. References the processing efficiency theory to establish that negative attitudes and emotions consume the working memory for decision making, and therefore reduces nurses' capacity for optimal decision making, which is critical within the constantly changing and highly acute care setting. Furthermore, the development of depersonalization is associated with negligence of duties and reduced attentiveness, hence resulting in increased rates of adverse events. Correspondingly, a 2012 study distinguished that nursing care is implicated in prevalence of healthcare-associated infections and is associated with morbidity and mortality rates. Whilst burnout is a strong determinant of patient safety outcomes, the consequences of burnout extends beyond the quality of patient care and strongly impacts upon the physical and mental well-being of nurses, and hence a healthy work environment. From the psychological aspect, burnout has been implicated in the experience of anxiety, hopelessness, feeling overwhelmed, loss of empathy, and cynicism towards their jobs. An Australian study revealed that due to repetitive exposure to traumatic events such as illness and death, approximately a third of nurses met subclinical levels of anxiety, depression, and somatic complaints. Meanwhile, the physical elements of burnout are strongly correlated with fatigue, insomnia, headaches, and GIT problems. These negative outcomes significantly impact the working environment, whereby cynicism towards the profession is negatively associated with a poor sense of community, and high levels of burnout is associated with increased rates of absenteeism and poorer nurse retention rates. This further perpetuates the issues of inadequate staffing and unmanageable workloads, which are ultimately catalysts in burnout development and are significant determinants of the quality of patient healthcare. Hence, it is unsurprising that studies have revealed that burnout is contagious amongst colleagues, whereby nurses who have reported high rates of burnout amongst their colleagues are more likely to experience burnout themselves. Ultimately, burnt-out development is highly detrimental to the physical and emotional well-being of nurses and the establishment of healthy workplace environments, thereby negatively impacting patient healthcare outcomes, whereby nurses are unable to deliver safe and high-quality care. The adoption of certain leadership styles within the nursing context are highly influential in the development of burnout in nurses through their direct and indirect influence on the work environment. All dimensions of transformational authentic leadership styles are strongly associated with high levels of the 6 critical characteristics of the area of work-life framework, and hence are implicated in the prevention of burnout and promotion of high levels of engagement in nursing. Transformational leadership is illustrated by leaders whom establish and sustain high-performing workforces by inspiring others and working towards achieving a collective vision, and hence is a favorable style of nursing leadership through its facilitation of an adaptive and cohesive workforce. Drawing on social identity theory, transformational leadership style is negatively associated with burnout development, whereby the strengthening of social identity promotes individuals' positive sense of self, protects team members from the impacts of interpersonal strain, and ultimately enhances individuals' capacity to cope with stress. Within the nursing context, transformational leaders are a protective mechanism against burnout development through their ability to instill passion for the job, promote optimism for the future, emphasize fair reward and recognition of staff, and support commonly held goals for their nursing unit. Authentic leadership, however, is distinguished by a pattern of transparent and ethical leader behavior that encourages openness and sharing information necessary to make informed decisions, whilst welcoming input from those who follow. Authentic leaders create ethical and inclusive work environments through their demonstration of the key behaviors of balanced processing, racial transparency, internalized moral perspective, and self-awareness, which facilitate higher levels of trust in management and active participation. Authentic leadership is positively associated with the presence of structural empowerment. According to Cantor's model of organizational empowerment, accessibility to information, support, resources necessary to perform the job, and learning opportunities are core structural factors which have been identified to promote the development of occupational coping self-efficacy, which is protective against burnout through increased adaptive capacity. Ultimately, the authentic leadership style is effective in the reduction of burnout and is associated with greater job satisfaction, nurse retention, and improved physical and emotional well-being. Hence, the adoption of an authentic or transformational leadership style by nursing managers are an important catalyst in the establishment of a healthier workplace environment and burnout prevention in nurses. The transition process from student nurse to registered nurse can be stressful for newcomers to the profession, whereby the intense and demanding nature of the job can produce burnout. New graduates are required to comply with the Nursing and Midwifery's Code of Conduct and Code of Ethics. Both these codes emphasize that nurses have an ethical and professional obligation to promote health and well-being for people and their families, colleagues, the broader community, and themselves, and that nurses have a responsibility to maintain their physical and mental health to practice safely. Specifically, the 2018 Code of Conduct outlines that nurses have a responsibility to act to reduce the effect of fatigue and stress on their health, encourage and support colleagues to seek help when concerned that their colleagues' health may impact upon their ability to safely practice, and to seek expert, independent, and objective help, such as through accessing EAPs. New graduate nurses must be accountable for maintaining their own physical and mental well-being. Hence, nurses have a responsibility to engage in self-care activities, such as mindfulness-based activities, cognitive stress management, and leading a healthy lifestyle, which are known to be an effective protective mechanism in combating the inherent work stresses that culminate in burnout. Lastly, new graduate nurses can embody the role of transformational leaders and prioritize their physical and emotional well-being through taking sick leave without feeling guilty and ensuring that they take scheduled work breaks. Furthermore, new graduate nurses can be instrumental in creating healthier workplaces by challenging the destructive attitudes that praise working overtime, by assertively refusing overtime in an effort to make rest and recuperation a nursing priority. Ultimately, through the adoption of positive leadership styles in nursing, burnout development can be addressed and prevented, and nursing retention rates can improve, and hence healthy work environments and the delivery of safe and quality patient health care will be an Australian reality.